Okay, ready?
Uh-huh. Okay.
One, two, three. We're back.
Hello.
Long time no see, everybody.
For anyone that don't remember, I'm Chris.
And I'm Clarissa, and this is When the Pharmacy Closes podcast.
So we have been gone for a while. The last
Yeah.
time we recorded, I think, was in September last year.
Yeah, and a lot of people that support us and listen to us have been wondering what happened to the podcast and the weekly episodes.
Let us explain.
Please forgive us.
So last semester, as you know, we are pharmacy students. So last semester, we started our first classes of therapeutics. It's called ISBP. Don't ask me what it stands for. I
have
don't
no
know.
clue.
But that hit us a lot harder than we thought it was going to.
It hit me like a bus. Chris is doing great.
But we're still struggling. It's very like detailed stuff. We're learning how to, I guess, like the treatment options for a lot of different conditions. And some of them can be a lot more complicated than we thought. It's not as straightforward as I had originally thought.
I never thought it was going to be straightforward.
Not necessarily straightforward, but like, I don't know, especially cardiology. It was kind of annoying because the heart kind of sucks. It can throw things at you.
No, that one hit me like a bus and then dragged me 100 feet with it.
She's just like, help.
I'm like, help me, please. And then just a little disclaimer before we go on. I'm getting over a sickness right now, so if my voice sounds a little funny and I'm sniffling a little bit. And I also have a pack of tissues right here next to me.
If you are watching the video version.
Yeah, if you're watching the video version, I'm holding up the tissues right now.
That's partially my fault. I did get her a little sick, but the level it's gotten to, that's not on me.
It honestly hit me. I haven't been sick like this in forever, so I don't know if it was the stress from starting the semester again.
Could have been.
But I'm going through it right now. I have like 2 cough drops in my mouth, so maybe I'll pull some out later. You're just going to hear like the crinkle of the paper.
ASMR.
Yeah, the ASMR of the episode.
I might need one too, low-key. I can feel a little tickle.
Oh, do you want one right now?
You know, maybe we should.
Okay.
While you do that, I'll go ahead and explain. So, some updates to the podcast. So, because of how busy, you just hear the crinkling in the background.
Here, I'll give you 2.
Thank you. Wait, I don't know if I want to do this now because they're just going to hear like all the noises in the microphone. Anyway, so like we said, it kind of hit us really hard last semester. And because of that, we decided to prioritize studying and kind of getting the hang of ISBP. So we took time away from the podcast.
A long time away. I was kind of sad. I feel like throughout the whole semester, we were like, oh, we need to get back into it. We need to get back into it.
We did say it a lot because it's a kind of a way to let it out, if that makes sense. Like it's an outlet. It's still pharmacy related, but we're venting and not kind of stressing about it.
Yeah. And then several people, my sister's like, when are you going to come out with a podcast again? My boyfriend was like, I'm your biggest fan. When is the podcast going to come out again?
Where's the merch?
Yeah, he was like, where's the merch? When are you going to release the merch? I'm like, I don't think we have enough following for the merch.
I know. I think we're still building.
Yeah, we're still building, but maybe one day.
But yeah, so we decided that we wanted to restart this semester. We do want to stay consistent this semester, but we decided we're going to be doing it kind of just like in a raw style.
Yeah.
So recording and like maybe like editing roughly here and there if anything needs to be edited, but if anything we want to just put it up there because if anything it's more realistic as well.
Yeah, more down to earth. Never mind. Maybe that's why we need editing. More down to earth, not as, what is it, I guess, like...
Artificial.
Yeah, as artificial.
That's what we'll say. We're not YouTubers, y'all. We don't got time for that.
I know. It was just a lot of work editing for Chris because...
Yeah. Tell the people.
Because he's more tech savvy than I am. So it was a little hard for me to edit.
It is difficult. I think people, like, if y'all watch YouTube, I'm sure y'all do. If you do, and people are always like, it takes a long time to edit. You don't think it does until you do it.
Yeah, until you do, you're like, okay, maybe it does take a little bit of time.
Yeah, so I'm like, this kind of style we want to do now, kind of just upload raw with, like, minor things if we need it. But I think this is good.
Yeah, this is good. But in my defense, I did help. I am the owner of the Instagram account, so I'd make all the Instagram posts. Well, I guess compared to hours of editing. But 30 minutes of posting a picture on Instagram was still a lot of work for me.
My gosh, hard work.
It was so hard.
I will say she listened to the episodes and would tell me where to edit.
Oh, yeah. So you can't complain. Okay, I guess you can't complain a little bit. What else are we going to do?
We thought for this episode, for one, we did want to explain some updates to the podcast to hopefully be more consistent and the changes. And then just kind of explain what our last semester was like. New Year's
just give some
passed,
updates.
So some New Year's resolutions, if any. But let's talk about the last semester.
Hold on, I'm about to pop another cough drop in my mouth. This is like number 3. There's like 3.
Y'all don't see, like, every day she's popping, like, I don't even know how many a day, but
it's because I can't cough in class. People are just gonna, I'm wearing a mask to class, so I'm not coughing on everybody. But still, I feel like when I cough, I'm like hacking and yakking it, so I don't want people to be like, oh, you know?
like, ew.
Yeah, when we had our ISBP exam on Monday, I was so afraid for the people that were sitting around me. It's like when you hold in those coughs and you're like, But yeah. So last semester?
Yeah. Okay. So last semester it's kind of weird. It was kind of weird. So first semester of pharmacy school, I think hit us really hard because we went from undergrad to pharm, and that was like a big change. So it was a much bigger workload than we expected. And then second semester, it cooled down.
Yeah, second semester of P1 year just really mellowed out a little bit.
Which I think was not the best. I mean, I don't think they do it intentionally, but it wasn't the best curriculum choice because we went like super hard, pretty chill, like people were going out each weekend.
Yeah.
I honestly wasn't that stressed the second semester. And then third semester came and I wanted to cry.
You were like, please.
But like there were days I would tell like Athena, Christy, and Clarissa, like my usual group, I would be like, I'm sorry guys, like I feel like I'm being such a douche. Like I don't feel like studying. I don't feel like being around people. I just want to go home.
Yeah, like I think P1 year we would stay a lot after school and like study together, or we would stay as late as we could in the building so that we could study. And then our first semester of P2 year, and we just all wanted to go home after the school day. It was so long.
It's a lot because...
we're still P2s, by the way. We're
in our third block of ISBP right now.
Third block of ISBP.
So the way ISBP works is that there's 2 blocks per semester. Blocks just refers to like 7-week periods, and each one hits different disease states. So what were like the first ones we hit? It was stuff like
asthma, COPD, pain.
Ooh, pain is dumb. I really hated pain.
Pain. Was that it?
I think those were the first things, and then after that, it was a lot of GI stuff, like ulcers, GERD, and then
I think that was it.
And then like what's it called? Brain work. Come on. Eating disorders.
Oh, eating disorders. And then the second block took me out. Maybe I'll talk about it if I feel comfortable.
Well, true.
I'll talk about it. I don't care.
Let's go a little bit on the first block. I think the reason I said, so pain honestly was my least favorite of the first block. Because the good thing about the other ones was that like everyone has heard about like first line medicine or medication. And then there's kind of an algorithm you go through. So it's like, this is the first one. If that doesn't work, this is the next option. And then like
if it's uncontrolled, then you add this. If it's
exactly. So there's like a path you can follow and pretty much look up in the guidelines if you have to. Pain's not that way.
No, pain is definitely not that way.
And it sucks because pain is like the rest of them have like specific diagnostic things you can look at. Yeah. Pain is just, how are you feeling? How painful is it?
Yeah, and I think it's just very dependent upon the person, right? Like each patient is different with their pain levels. So I think that's what made it a little hard.
And what threw me off is that a lot of the medications we use for pain are not even indicated for pain.
Oh, yeah. Like what?
Like gabapentin, pregabalin, all of those. That's for like...
No, but they are. They're for nerve pain.
Are they FDA approved for that?
I don't know, Christopher.
I don't know either. I just know that's not their number one indication.
I just know it's very commonly used for that.
Yeah, or stuff I guess you're right. Well, like propranolol, that was used for headaches and migraines a lot.
Oh, yeah.
But the indication is blood pressure.
Oh, yeah, the beta blockers. Yeah, that's very true.
So that was douchey. And that exam was hard.
Yeah, the pain exam? Yeah, that one was hard.
And then was there anything else significant about first block, what'd you say?
I think it was a nice introduction block.
Yeah.
I mean, we experienced PALS for the first time as well. Right? That's where we were first introduced to PALS.
Yes.
And it's basically...
Yeah, okay.
I think it's more of we have skills lab as well, but I think that one's more of a skills lab than actual skills lab.
They hit different skills.
Well, yeah, I guess integrated skills hits more like the interviewing process and talking to the patient, right? And then PALS lab is like the more hands-on physical exams.
I think PALS is like very ambulatory centered kind of stuff. I love
ambulatory. That's what I hopefully want to go into. Or hospital, but who knows?
For those who don't really know, ambulatory is a type of pharmacy where you are managing disease states for patients. So often ambulatory pharmacists have like a collaborative practice agreements with physicians where they have the ability to prescribe some medications for different disease states, commonly like diabetes and stuff like that.
Diabetes, which is what we just recently learned about.
Honestly, one of my favorite.
Honestly, it was kind of easy, huh?
It was diabetes was pretty straightforward.
Yeah. Yeah, we did PALS. I think PALS was super fun. We're still in PALS currently. But what do you do in PALS? We learned how to do breath auscultation and percussion.
Oh,
and,
I thought you were going to say cardiac.
Listen to the heart.
I think those were the only 2 exams we did the first semester.
Yeah, and then they connected together, and honestly, OSCEs are kind of my thing.
So her strong point for sure is like patient interaction. You remember like counseling points really well, stuff like that.
Yeah, I love doing the OSCE, so I like the one. Even though the day of the OSCE, I was so nervous.
Was it the final or the first one?
Well, both. Okay, I have a story to tell for the midterm OSCE, but for the final OSCE, I do super well in like patient interviews and the actual hands-on aspect, but I get so nervous. Remember when you were like shaking for the last one?
Yes, and we were breathless.
Yeah, I could not catch my breath on our final OSCE. I was talking to the girl and I feel she could tell that I was like not breathing right.
I think our instructor too, you told her you were like, I couldn't breathe. She's like, yeah, I know.
Yeah, because it's that feeling where you're like talking and like
our instructor was like, oh yeah, I could tell you couldn't breathe. It's kind of like, you know how when I don't know if it was only when we were wearing masks or not.
I think it's because you're so close to them. I don't want them to hear me breathing, if that makes sense.
Picture yourself on a treadmill and you're talking to someone.
And then you have your stethoscope in your ears, so you can't really hear anything.
But you're articulating everything, saying everything that you're doing.
Yeah. So maybe that's why I was nervous. I was like, don't hear me breathing. I promise I could breathe.
I think we both had a moment where we had to like step aside just to breathe for a second.
I told Chris that I should have gone to the corner and was like just to catch my breath, but I didn't. Like I could not breathe.
I remember I told my patient too. I was counseling her on the medication, and like I realized I was really losing my breath at that point, and I was like, sorry,
I need a second.
I had to pause for a second.
But since we're on the topic of the first semester, let me go ahead and tell you what happened during my midterm OSCE.
Oh, yes.
Okay, so I feel like it's a good story. Anyways, so our midterm OSCE was also at main campus, which is where we're at right now, in the nursing building, in their like little sim labs or whatever. So I go in. Well, when they're prepping you, they're like, okay, so the grader's going to be in the room and the patient's going to be in the room. So like the way it is kind of like, would you say it's like a Hunger Games style where they put you in the tube and you're about to like go into the room. So you like line up in front of the door and they're like, okay, you can go in now.
It's very much what how you see the simulation was on TikTok.
Yeah, what's on TikTok or like the memes of medical school and stuff. So you're standing in front of the room and they tell you to go in. And I only see like the actor patient in the room. And in my head, like I'm still set on, okay, the grader is going to be in the room. So I go and I sit on the chair in front. So it's like we're sitting like this.
Yeah, if you're watching the video, we're kind of demonstrating it.
Yeah, like our knees were like facing each other. And I was like really close to the actor. I don't know why the chair was set up like that. So we're like facing each other. Like he was closer. And I was like, are you the grader? I asked the patient. I was like, are you the grader? And he was like, no. And I was like, okay. So I literally just stood there. I sat there in silence with him waiting for the grader to come in. And I didn't know that my time had started. So then Dr. Padilla comes in and she's like, oh, your time started when you walked in. And I was just sitting there waiting for the grader to come in.
She's all just like...
Yeah, and I remember it was awkward because the guy was probably like, why isn't she doing anything? I was just like waiting there.
For context, the way our OSCEs had been up until that point was that there was an instructor either physically in the room with us, or we knew that they were filming us like from a laptop or something.
Yeah. But this time I didn't know that. They were watching us from cameras. I mean, the cameras were inside the room, but they were watching us outside the door, and I didn't know that they were going to come in. So after that, I think I got like super nervous because I had already lost some time just sitting there waiting for the grader. I had already lost some time, so I was like, oh, trying to get the medication history. And then I was also super nervous there because I was flustered that my time had already started.
And I think for that one, we only had 10 minutes.
Mm-hmm. I just thought it was so funny in the moment. I walked out and I was like, damn. I was like, yeah, it was the most embarrassing thing I've ever done.
It was so funny. I think the only reason that, because I was the first group that went, I think you were second or third group.
Yeah, I was a little later.
Because like I think six people went at one time.
Mm-hmm.
And the only reason that we knew time started as soon as you walk in was because one of our classmates, Jesse, shout out to Jesse, he asked like, oh, does time start when like a grader walks in, or is it when we walk in? And then that's where they told us. So all of us knew, but they didn't tell the rest of the people.
Yeah, so that's why I went in and sat there in front of the guy, waiting for the grader.
Mm-hmm. It still went well, I think.
Yeah, it still went pretty well. I still got an A or whatever. But, yeah, it was just embarrassing, I think, because the guy was probably like, damn, what is she waiting for?
Especially because it wasn't the first one. He was probably like, all of them just started. Why is she just sitting here?
I don't know. But if I would have known that, I think I would have gone in like confidently knocking on the door, like, hey, I'm Clarissa. I'm the pharmacist intern today, you know. But, you know, are you the grader? And then I sat down. But yeah.
With the same OSCE, I didn't have as funny a story, but I know I kind of messed up and they didn't notice.
Oh, they didn't notice?
They're going to hear this now. But I know my grader didn't notice. So we were doing a pulmonary exam, but just the auscultation part, which just means we were listening to the lung sounds or breath sounds. Mm-hmm. And there's a specific way you have to do it. If you can picture the chest, there's 6 points going down each side that we're supposed to listen to.
Yeah.
And the bottom parts, kind of think of like the nipple line is where it should be, but some are on the inside of the chest and some are on the outside. I know the order I went in, I think I started correctly, and then in my head I second guessed, so I just like slid it on over to the outside of the chest, and then I'm doing the exam, and in my head I was like, no, I was right, so I just slid it on back over. And then Dr. Padilla walked in, and she was like, perfect technique, you did so well. And in my head I was like, You're like, perfect,
I did. Perfect.
I did.
Sorry, Dr. Padilla. But yeah, that's how PALS went. I really enjoy the PALS and skills labs, especially when they connect together.
Yeah, I think PALS is more like the physical type of exams, and skills is like the interaction kind of things.
Yeah.
Because the OSCEs for skills I found to be more stressful.
Yeah.
Just
because we were on a time limit. Like, we were getting the patient medication history, and that includes like family history, allergies, med name, strength, dose, how does it come, how many are you taking, what are you taking it for, what else am I missing?
On top of all the questions for why are you here?
Yeah, why are you here? Like the chief complaint.
And we had to get it all done in 10 minutes.
10 minutes. You better talk fast.
And that was part of our final OSCE. It was a combination between skills and PALS. We had to do the interview first. And then we had to do the physical exam based on like the information we got in the interview.
Yeah.
And when they're watching you on the camera at the sim center, they'll give you an announcement to kind of give you an idea of where you are on your time. So we had 10 minutes to do our interview, and I remember I'm doing it. I think I'm doing great. I'm typing up the information, and all I hear, and I'm not even halfway done with the interview, all I hear is 2-minute warning, and I just go like, and the student that was helping me, like being my patient, her eyes just go, like they grew.
She said, you better hurry up, boy.
And I was like, forget the rest of this information. I'm just getting what I need.
Yeah. Honestly, you have to learn how to talk fast in these situations. But what else? Oh, and then we hit ISBP block 2.
Which was very cardio heavy, like heart heavy.
The deep breath, the sigh.
I don't think, so it was stuff like hypertension or high blood pressure, stuff like angina, heart failure,
PAD,
high cholesterol,
AFib, heart failure.
For me, the hardest one was heart failure.
Nothing's hard for you.
No, I hated heart failure.
The seriousness, or nothing's hard
I'm like,
for you.
I hate heart failure.
Yeah, the heart is really hard.
I think blood pressure, for the most part, is pretty kind of straightforward.
Yeah.
Like, there's first lines and second lines. And then, I didn't think, like, AFib was horrible. PAD wasn't too bad either. The reason I didn't like heart failure was because they're called pillars, the 4 pillars of heart failure.
Pillars of heart failure.
What are they, Clarissa?
Okay, let's see if I could get them right. Let me do a little stretch. Okay, there's ACEs,
Yes.
ARBs,
Yes.
ARNI,
Yes. Those are all-
SGLT2s.
Yes. I'm blinking a little bit too.
What's the?
Oh, I have one in my head.
Tell me.
The MRAs.
Oh yeah, the MRAs.
What was the 4th one?
Definitely not beta blockers.
No, it was.
Was it?
Yes.
Oh.
It was beta blockers.
Okay, so hopefully that's right.
Please don't watch this, Dr. Singh.
Please, all of our professors, tell us if that was correct.
But okay, so there's those 4 pillars, right? And those are kind of like, you start with those kind of based on the patient's their overall condition, what's the best option.
Yeah.
And then you start adding on therapy. But at some point, you have to decide, do I max out one of the medications or increase the dose? Do I add another thing, or do I add an add-on therapy that's not one of the first lines, but it'll help?
I don't know. That block just really messed me over.
I didn't enjoy it. But I just have to go back and look at it all.
Yeah.
You're like, I don't want to, but yeah,
Should I say it or no?
up to you.
I mean, it'd be helpful for the students.
Yeah.
I guess. Okay, so for second block of ISBP, basically the end result is that I have to remediate that block. But you're not going to catch me lacking this semester, okay? That's not going to happen again.
We're doing great so far.
Yeah, honestly, we're doing great so far. I pursed. I passed my first exam. So right now we're doing good. I think I've finally kind of figured out my way of studying. So hopefully I can get through like future blocks. But I guess I would just wanted to mention the remediation because, I mean, it's a real thing and not... it's a real thing and a lot of students go through it, and I don't want other people to feel embarrassed, I guess.
It's not something to be ashamed of because, I mean...
Honestly, at first, I was really ashamed.
Which I don't blame you. But at the same time, you're hearing us say it's hard because it's hard stuff and we're having to learn it very quickly.
Yeah, but honestly, there was no excuse for me not to pass. I ended up just being hard on myself. But I'm going to go through the remediation. Like, life is going to go on. Life isn't stopping for me at here. I just need to figure out my ways of studying and then just move past it, do the remediation and then just hopefully keep a positive attitude. So remediation is a real thing. I wouldn't feel ashamed if you have to do it. I think to me it was more of a wake-up call because I don't want to go through this stress ever again. But now in this semester, I'm doing pretty good. Granted, our first test was really easy, but I think I'll be okay now.
I think so.
Yeah. What else happened the first semester? I think that's basically it.
I think so. And then we went into break. Well, I have a story not related to class in the first semester, but somewhat related to the first semester.
Okay. Spill the tea.
So take advantage. Really prioritize work-life balance. Because
we have updates about that.
Yeah. So I don't want to go into too much detail.
Oh.
But I basically got around finals week. I got sick.
I can eat this.
Go for it.
I'm popping them cough drops like they're candy.
Your tongue is going to be
gone.
Clinging on to life.
No, for real. Okay.
But okay, so finals week came and I started feeling, I don't know if I would call it sick per se, but so some context for me, I have like a phobia of like throwing up and stuff like that, and like the feeling of it. And I don't know why. During finals week, I kind of got this feeling in my throat, like it felt like I wanted to get sick, but I never did.
All the time.
Yeah, like constant feeling. It just wouldn't go away. And like it had happened before, but it wasn't something I couldn't just, well, not necessarily ignore, but I could kind of tolerate it.
Yeah.
And during finals week, Clarissa and I, we went to Clint early college, one of the
Oh yeah, we did.
one of the high schools, to give like a presentation on the pharmacy school, because those students, some of them are already going to graduate with like a bachelor's.
No, associates.
Associates. So they were already pretty, if they wanted to do pharmacy, they could get in pretty quickly.
Yeah.
And during one of the presentations, like it would hit at random moments. And I had to go to the teacher in the middle of one of the presentations and be like, where's the restroom? Because like, I do not feel well.
Yeah, we were literally in the middle of the presentation. I was talking. Then all of a sudden he like quietly steps out.
Yeah, I don't know why it hit me. And in my head, I was like, I just need to get out of here like now. Mind you, I didn't get sick. I have not gotten sick because of it. But I remember she already knew what was going on with me at the time. So I texted her and I was like, I'm sorry, dude. It hit me and I don't feel well.
Yeah, I was like, it's okay, just go.
And so I went home, which that drive was already horrible.
It was so
home.
far. I never realized how far Clint is. It's
I know.
so far.
Even from my house.
Yeah. And I live in the Northeast. That's so far.
For you, it was probably like a 40-minute drive, no?
Yeah, it was
Roughly.
40. It was 40 minutes, yeah.
For me, it was still like 25-ish minutes from my house.
Oh, yeah.
And I live east side.
Shout out to the students that live in Clint. Woo, woo, woo.
Whoa, whoa, whoa. But that drive home was horrible because, so this time that I had that feeling, it got to the point where it started affecting my daily life. So I didn't want to drive anymore because it would get worse while I was driving. I didn't want to eat because like the feeling would just kind of get worse when I ate.
Yeah.
I know like we wanted to go out with our friends one day and we were like, oh, let's do an escape room. And I was
yeah.
like, my body will be very aware that I'm in a locked room and it'll get worse.
Yeah. But
So that, I thought it was just the stress of school and then come into the break and it just continued.
that wouldn't go away.
It wouldn't. And so I ended up, I even talked to like a therapist thinking like, okay, like I know this is a phobia. Maybe I need to talk to someone. Maybe it's anxiety. It wasn't anxiety. I don't know fully what it was, but I ended up just getting like a little anxiety med just in case the feeling ever gets bad. Cause like my heart rate would like shoot if I thought I was about to get sick.
And didn't you say you wouldn't didn't you say you wouldn't drive on the freeways or
Yes,
the
because
highways?
on the freeways it would get worse. But even on that drive home from Clint, even on the side roads, like I still had to stop at a gas station because I was like I cannot get home.
Yeah.
So even now, I'm still trying to get over it. But the point of that whole story was that I think I overdid it last semester because we would go to school Monday through Friday, and ISBP 4 days a week, studying late a lot of the days, and then I would work Friday, Saturday, Sunday.
Yeah, that was crazy because I would do something similar where I'd only have didn't we have class on Fridays? Wouldn't we not
Yes,
work
we had
Fridays and we
PALs.
would work Saturday, Sunday?
At first, we would work Fridays because we would get out of PALS by like 11 or 12:20
Oh,
or something
yeah.
like that, and we would just book it to work.
Yeah, I don't know why we thought that was smart.
Well, because in our head, we were thinking income,
Money.
but then that ended up hurting us.
Yeah, so now we learned our lesson and now me and Chris only work one day out of the week.
The change that has made, though, like, I feel so much less stressed. It's nice to be at home, like, having all day to study if I need it.
Yes, it does feel great.
Because, like, even for us, too, like, there's a different, like, we would work, right?
Yeah.
But we would come to pharmacy school
Uh-huh.
and then go work in a pharmacy. So at the same time, we would never get a break from pharmacy. And while that is our career path, I think we need to step away from it sometimes.
Oh, yeah, for sure. But now we only work. Well, I work Saturdays because on Fridays I have sterile compounding lab. So I don't get out till 1, so I wouldn't even be able to go into work anyways. But hopefully when this little block ends, I'll be able to work Fridays and then hopefully get Saturday, Sunday off. And that would be perfect. Mwah.
I did that for the first week so far. We're on week 3 for the record. But all of my Fridays have been getting switched with people, which I'm okay to help them out.
Yeah, because it's still okay to work Saturday and then you have like the whole day Sunday to
Yeah.
study. And then even if you don't work Friday, you could still go home on Friday and study too, you know?
But the first weekend when I worked Friday, the only shift I can do is the afternoon. So I got off at 9:30. And then the next morning, I'm still in bed at like 9 in the morning, and I'm usually up by then for work. And my twin, he's knocking on my door and he's like, "Don't you work today?" My eyes are still closed and I'm like, "No."
You're like, it feels amazing.
And I'm like, "And good night."
you like roll over, you're like, good night. Yeah, it feels so good not to work. So many days.
Yeah, a lot of our pharmacists were telling us too. They're like, you want to work, but
I don't
like,
think it's a
don't
good
overdo
idea.
it.
Yeah.
Okay, so I think we can get into maybe like what classes we're doing now in our spring semester, in addition to the changes we made at work, which is the working 1 day a week.
So
if you
right
wanna
now,
start.
right now we're taking ISBP. I don't know. We're taking so many. I still don't even know our schedule. We're taking ISBP. Me, Chris, and Christy are taking sterile compounding in the lab. And then we're taking all like the essentials, pills,
Yeah, the normal
skills
classes
lab,
like pills and skills, pals.
pals.
We did diabetic foot exams, so
We did diabetic foot exams. We had to have our feet out, and we were touching each other's feet with gloves.
still
But
though,
we were touching each other's feet.
we were all shy.
The dogs were out.
So P1s look forward to that.
Everybody was like, I need to go get a pedicure done.
Literally, I think they told us like 2 days before that we were gonna do it, and everybody was like, hygiene was like on point.
I got my toes done like a couple days before. I was like, oh, thank God.
We're like, woo!
Now we're like poking each other's feet with the little filament.
Oh yeah.
And like tickle, tickle.
We're like, oh no, we were playing with the little tuning forks.
Oh yeah, yeah. Honestly, it wasn't that bad.
It wasn't, but I don't want to do it again. Although
Well, we're gonna have to. We're gonna have an OSCE where we have to like examine somebody's feet.
I'm all right. Well, not necessarily all right touching someone else's foot, but I don't want my feet out.
Oh yeah, our dogs were out. Yeah. What else are we taking? What did I miss?
I'm like, let me go to the
We're taking patient safety and law,
We love law.
Spanish.
That's
Our
right.
last semester of Spanish. Woo! What else?
Oh, we're gonna go to the schedule.
Yes, go to the schedule.
Patient safety and law.
Research methods.
I think that's all of it.
Yeah, I think that's all.
The one that takes most of our attention is ISBP.
Yeah. But I don't think there's anything like drastically new.
Watch us be forgetting like a huge class.
I know, I'm sorry.
But anyway, so what we're doing in ISBP so far this block, the last 2 weeks, so we're in week 3 right now. First 2 weeks were dedicated to diabetes.
Uh-huh.
Like we said, we liked that one.
Oh, and then I like this schedule for ISBP. I mean,
Oh yeah, they altered it a bit.
yeah, so now in this block, we have exam 1, exam 2, and then we have a midterm of all the material that was in exam 1 and 2. And then we'll have exam 3 and 4. And then a little bit like new material, right? And then whatever we took for exam 3, 4, and then whatever little material we learned will be on the final. So it won't be, I mean, it's still going to be cumulative, but not from the whole block.
Right. Because that's how the previous 2 blocks of ISBP were, that it was the whole 7 weeks in one final, which, I mean, understandable. But also, we're learning so much at a very fast pace that I'm going to be 100% honest. By the time we got to the final and like the first block,
I had already forgotten.
yeah, I was like, asthma, what's that? Like,
It also helps because I'm so grateful that Dr. Abdul Hakim moved our exams to Mondays.
yes,
Because I remember when we had our tests for Fridays for, I don't know which block it was.
it was second block.
Oh, for the second block, our exams moved to Fridays, and it was so hard because we would be, okay, so for the first week of material that we learned, we would have the weekend to study that material, so that material was okay. But for the second week of material that was going to be on the same exam, we would like learn the material during the week, and then that Friday we were taking the exam, and I thought that was so hard because I'm the type of person that does need the weekend. So
When especially sucked in the terms of being a P2 taking exams on Fridays, first off, we would get new material on Thursday. That was going to be the exam the next day. So
Yeah.
less than 24 hours to get it in your head.
yeah, that was hard.
But the other thing that sucked was that, so come P2 year, your rotation is you have to go to UMC
Oh yeah.
after class and spend at least an hour and a half there. You do it 5 times in one semester.
And it's great when you have the 4:30 rotation, like 4:30 to 7. But when you have the 7 to 9 shift, sometimes it's so hard because by the time you get out of class, maybe it's like, what, 4?
Our latest, yeah, 4.
And you go home, it's 4:30. What do you have to do? Like, you eat, try to do some homework, and then you have to, like, leave your house to go to UMC to do your rotation. And I feel like that's just, like, a weird schedule.
And then to like put the pressure that you have an exam on Friday, it takes time away from studying.
Yeah.
Whereas the weekends, no one is scheduled to go to UMC.
Yeah,
So we
there's-
all have the weekend to study.
Yeah, that's true.
We've been told many times that our class is babied, but we'll take it.
We'll take it.
I like it.
I like it, too.
And then now in ISBP, we're starting male disorders.
Yeah, along with the thyroid disorders.
That one got like a whole day, just one day.
But that one's, there's hypothyroidism and hyperthyroidism. So it's fine.
And then right now we're doing like BPH, we're doing erectile dysfunction,
Urinary
incontinence, I think. And then at some point we're going to get into women's health, maybe like next week.
No, tomorrow, no.
Really?
Or no?
I'm not. But no, tomorrow's pharmacotherapy.
Oh, so then probably next week.
The way ISBP, really quick, the normal like setup for ISBP is you get like whatever system it is you're working on, you get kind of like the anatomy of it / pathophys. So why does X condition happen? Like what goes wrong?
Yeah.
Then you get the pharmacology. So it's like, this is the drug. This is the mechanism of action. These are the shimmies are back.
The shimmies are back.
There's the like side effects, the contraindications, any interactions, stuff like that. And then you get pharmacotherapy. So this is what the patient shows up with. This is how you start treating.
Yeah.
Which I've been asked before, y'all aren't doctors. Why are you learning how to treat?
So that way we can make recommendations to the doctor.
That's how I respond. I'll kind of be like, we're the second check. In case like the patient has some sort of something that like maybe what the doctor prescribed isn't the best option and there's something better, then we're kind of that check for them.
Yeah.
So that's usually my answer.
Why are they questioning us? That's my question.
Well, I don't know.
What else?
I don't know. We're only 3 weeks into the semester, so not too much yet.
I guess we just wanted to give you updates on why we've been gone, what we've been up to,
what our plans are for the podcast.
Oh, do you have any New Year's resolutions for yourself, like personally, that you would be willing to share?
Sure. It's a small one, but everyone knows I suck at drinking water.
Oh,
So I'm trying to make sure I drink at least, if anyone sees the video, I have this little knockoff hydro flask from Amazon. But
I have this little knockoff Stanley cup that my
I
sister
hate
got
Stanley
me.
cups.
He hates when I bring this cup to school.
Okay, no, please tell me if I'm the only one who thinks this. Like the hydro flask and stuff, they're nice because you can just hold on to them.
Or clip them
by
onto
the
your
handle.
backpack.
Yeah, mine has a little clip. It's very convenient. Meanwhile, if you have a Stanley, you have to walk around like a freaking Boy Scout.
Not the Boy Scout.
Holding it up like this.
You're like, howdy do.
Exactly. It's just, I don't like Stanley cups.
I guess if you think about it, the straw is kind of not hygienic, huh?
Yeah, but I mean, these have a straw too.
But I have a little straw cover. But this one, the straw's too big for the cover, so I kind of have to shove the...
You gotta fold it in there.
Yeah, look. It's cute.
What about you? Any New Year's resolutions?
I actually have a list.
You have a list?
Pull out the list. I'll just share a couple. I want to exercise more. On here I put for my mental health and well-being.
I love those. All very positive.
I put save money because I'm the worst person at saving money.
Shopping at Abercrombie.
I love to shop at
That
Abercrombie.
place is expensive, y'all.
It is expensive, but the key is to shop there when there's sales.
Yeah, and the sales are still expensive.
Okay, Chris, you're right. What else?
I'm gonna switch headphones. Mine randomly stopped working.
Okay, while he does that, I'll continue. I put study harder and more efficiently. So right now I'm kind of working on that one.
And it's going well.
Working. What else is one? I put no procrastinating. I've been turning in on my assignments on time. I want to read at least 20 books because I really like to read on my free time sometimes. But yeah.
Couldn't be me.
And then I keep my room clean was another one because if you know me, last semester my room was a mess.
A little bit.
But most recently I've been trying to keep it clean just for my sanity, and then it just helps me feel more productive. So, but since I've been sick, it's gotten a little messy, so I just kind of need to freshen up so I can get all the germs out of there. And then I was going to talk to you about this one. I want to volunteer more.
Oh.
Yeah, we took an elective last summer for the it was for the LGBTQIA plus community, taught by Dr. Medlin. If he offers it, I'm going to give him a quick shout out. if he offers it again, I recommend you guys highly take it because I really enjoyed it. And during that elective, we had to volunteer at the Borderland Rainbow Center.
Yes.
Is that what it's called?
Yes.
And we worked a lot in their food pantry, and I really enjoyed it. I liked the people's company there. I know every weekend they would have volunteers that would go, and they seem like regulars, so I kind of want to find somewhere to volunteer so I could be like a regular, you know? But not just for the regular status. Like, I actually just want to
Volunteer, get out there.
Yeah, get out there. It also helps with more, like, networking skills and stuff like that. So,
Do you have any, like, mood board kind of things? Not mood board, vision board kind of things.
no. But I know my boyfriend started one for me and him.
Oh.
But not for myself personally.
She got a boyfriend.
I got a boyfriend now. But let me calm down. Anyways, I just have like a little list, and then I started journaling. So I guess if you want to count that.
Yes.
But my journal is kind of like a scrapbook. So it's just like a little, what is it? Stress reliever for myself.
A little separate thing from everything.
And
Escape
then,
from reality.
Since we're talking about school, 2 more are start being involved more in school organizations and start thinking about researching and researching residency programs.
That's coming up soon. On the topic of LGBT and student organizations.
Yes.
Y'all should also look into, if you're curious, the IDEA committee in SSHP, where it's a committee that's involved in promoting like LGBTQIA plus diversity and kind of being involved in events like that. So something we do on a plan this semester, or I guess at the end of the semester, is to, what you doing over there? We want to try to maybe like get a float or something in the Sun City Pride Parade this June. So I'm in the process of getting into contact with people for that. But I'm the chair, so if anyone wants any more information, let me know. Or actually both on the committee. So we'll also be having an event soon where we'll be doing the Hearts Around Campus, a scavenger hunt for February, which is Heart Health Awareness Month. And it'll just have different cardiology facts, and it'll also have some to your credit.
The little shout outs in between.
I know, shameless plug.
We're like, shout out to Dr. Medlin. Shout out to the IDEA committee. Or what is it? IDEA, right?
IDEA.
So
there's also another LGBTQIA plus committee on campus. It's part of the Ideal Pharmacy Council and is DEIA, so shout out to them as well.
Shout out, shout out.
I know something I want to do this year for sure is go to mid-year.
Ooh, but that already passed. Are you talking about for like the upcoming?
Yeah,
okay.
For this coming December.
Okay.
I mean, coming, it's in 11 months. But
I should go. I want to go too.
I think even if I don't do any presentation, I think it would be good to go for networking reasons, and especially when it comes to residencies and stuff like that.
Oh, yeah.
So I want to talk to my advisor. I want to get into doing a project, but at the same time, I'm like, I don't know if I have.
Like what kind of project?
At first, coming into pharm school, I was thinking like hardcore science, like this is how like different drugs might affect cancer cells and stuff like that. And then I would read about that stuff and I'm like, I am not interested in all of these very
like,
fancy words. So, but I did do a project in the summer with a CCP, and we kind of looked at how the impact of pharmacists involved in patient care, what impact that had on like chronic conditions like diabetes, obesity, and high blood pressure. That kind of interested me. It was more like a social kind of research. Yeah. And I figured out, oh, that might be something I might be into.
Yeah. I guess you can always talk to your advisor about it.
So I know that's on my vision board.
Ooh, a little vision board action.
Yeah.
We should have had like one of those vision board parties.
Still could.
Yeah, we still could. Still, I mean, the first month of the year just ended, so.
That's okay. People are still making them. We are people, but that's okay.
Yeah, you're right. We are those people still making them. But I think that's pretty much it for today.
Yes, I think so. It was a good little vent session.
Yeah, a good little vent session, a good little first episode to ease us back in.
I don't know if we'll call it a season 2 quite yet, but
more like a season 1 break.
Yeah, like how a lot of shows kind of have a, what do they call it? A mid-season finale.
Yeah.
And then a mid-season premiere or whatever.
This is our mid-season premiere.
Woo.
But we need to figure out how many episodes we're going to do until it's end of season 1.
Well, I think maybe first year altogether can be just season 1.
Okay.
Because let's be fair, we uploaded like 6, maybe? So,
Okay. Well, I think this was a good episode. Hopefully you guys enjoyed catching up with us, getting to see where we're at. The drought is finally over. And yeah, just come along with us as we finish off this semester, this P2 year.
thank y'all for listening, and
Don't forget to follow our social medias, and here they are. Hold on. We haven't done our shout outs in a while.
We gotta look them up real quick.
Our Instagram is the same as, oh no, it's not the same.
It's not the same?
Well, our Instagram is When the Pharmacy Closes, just like the podcast. So just look at When the Pharmacy Closes and you'll find us on Instagram. Go ahead and follow us on there.
You can also find us on, I might get these backwards, I'm so sorry. But you can also find us on YouTube, I think, at RX Closes Pod, and on TikTok at WTPC.pod.
Pod. Oh my God, you know what a New Year's resolution should be for our podcast?
What?
We should like find a jingle in the beginning, like a little song.
Oh, yeah.
And like a little outro jingle.
Do, 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 do.
Do, do, do,
Little
do, do.
acapella moment.
Yeah, a little acapella moment. We'll figure something out.
All right. Thank y'all for listening.
Thank you. We'll see you in the next episode. Bye.